Hello everyone, my name is Dr. Ravi Dadlani. I am a neurosurgeon with Phoenix Hospital, Musaffa, Abu Dhabi. I come with an experience of over 18 years with having operated over 3,000 independent surgeries involving pathologies of both brain and spine. A 45-year-old gentleman had presented to our emergency services with a sudden fall from a height of about 12 to 15 feet. He landed on his back and immediately after the fall was unable to move both his lower limbs. On examination, we found him to be completely paraplegic. That means he was completely paralyzed from the waist down and had no control over his bowel or bladder. He was evaluated initially with X-rays, then an MRI and a CT scan, and was found to have at least 2 big fractures in his lumbar spine. One fracture was quite bad with pieces of bone which had displaced back and gone and compressed his nerves. Patient was initially managed with all the emergency medications and then immediately taken in for an emergency surgery within about 2 or 3 hours of the fall. During surgery, large fragments of bone which were compressing on his nerves were removed and his spinal fractures were stabilized with metallic screws and plates. Post-operatively, the patient made a good recovery and he began to show some movement in about 3rd post-operative day, 3 days after surgery. In about 3 weeks, he could lift his legs off the bed but was still not able to walk, which he could at about 3 months. Assisted, he could take some help and go up to the washroom. During this period, his bladder recovery also occurred well. At about 6 months, he was completely independent functionally and is able to do all his day-to-day activities. There were several reasons for the excellent recovery that we see in this patient. The first was he was immediately transferred to the emergency services after the fall. Very early surgical intervention and excellent post-operative care. In case of such unfortunate incidents, we recommend that people seek medical assistance at the earliest. Thank you.